It is the discussion at many kitchen tables across this country each and every day, with the loss of loved ones and the deep concern of loved ones, neighbors, and friends who are struggling under the weight of substance abuse addictions in the face of an illegal and ever-changing toxic drug supply. The impacts are felt across the country, and it's been felt by friends, families, neighbors, and so many communities that I have met with and spoken to from coast to coast to coast. And too many Canadians have lost their lives to this public health crisis. As the Minister of Mental Health and Addictions, I know that we need to use every single tool at our disposal to connect people to healthcare. They need healthcare because we save lives through healthcare. And we need to get those who want the help and need the help to get the help to them where and when they need it. Communities across the country have asked for our help, and let me assure you here and now that we will be there with all partners, because everyone deserves access to the services and supports that work for them. And while no community has been left untouched by this crisis, some communities have been more deeply affected than others. So today I am pleased to announce the launch of the first call for proposals to the Emergency Treatment Fund. This is a $150 million fund that will help municipalities, First Nation, Inuit, and Métis communities rapidly respond to their unique needs. It will provide assistance to where it will make the most impact and help support a wide range of projects and services to respond to the urgent situation being faced on the ground. Communities know best what they need in the face of this crisis. Some of the examples of what we've heard so far that can be needed would include urgent recovery programming, on-the-land healing, harm reduction supports, such as naloxone distribution and drug checking equipment. We will be there to support communities so that they can quickly increase access to and have the availability of substance use services to improve their community capacity. We need to be able to scale with communities quickly, to be able to respond quickly, and to answer the need and the calls that have been made quickly, because lives are on the line. Applications to this call for proposals will begin now and be accepted until November 8th. This will be the first call of proposals of other continued calls that will happen through the duration of this fund. This funding, along with the dedicated work of those working on the front lines, will make a real difference in communities right across the country. We know that there's no single solution to addressing this crisis, and there's no single organization or single level of government that can solve it alone. But what I will say is that I know that there is hope. Communities truly do know best what they need to save lives and meet the needs of those struggling in addictions in their communities, because they are their neighbors, they are their families, they are their loved ones and friends, and they are also the dedicated healthcare workers, outreach workers, peer support workers, and so many more who are working on the front lines, on the ground, every day in communities doing this life-saving work. I'm confident that the Emergency Treatment Fund will directly help and support the services needed in communities quickly and effectively. Thank you.
Thank you, Minister. Thank you, PS Maggie. And thank you to everyone who has joined us today. I will now pass the floor to the moderator for the Q&A with the media.
Okay, thank you. Merci beaucoup. We'll start with the room with Stephanie Taylor from the National Post.
Hi there. Good morning. Good morning, Minister. You talked about there's been different tools to tackle this crisis. Do you think that involuntary treatment for minors and prisoners is a tool? And is that a tool? Do you see that as a viable tool to this crisis? And second, is this a tool that your government supports?
Thank you for the question. And what I will say is that certainly at the federal level, we have 4 key principles of what tools are in addressing the overdose crisis. They include prevention, they include treatment, they include harm reduction, and treatment is only one of the many tools. But what we know right now is that jurisdictions across this country do not have enough treatment beds available for individuals to choose to access at this time. They do not have enough services and supports in the treatment space. I'm focused on that. We've signed $200 billion worth of bilateral agreements, which have a component for mental health and substance use to address addiction services that are needed. And we will work with provinces and jurisdictions to make sure that they are providing access to those treatment beds. This is healthcare. I am not here to do anything more than emphasize that we are saving lives through healthcare supports and services, which include treatment. And the healthcare is a charter right. It is to help people in a space that they need dignity and assistance in their most vulnerable moments, and that is where we should be focused.
I guess, what do you make of policies that would put somebody in treatment, be it a minor, be it a prisoner, be it an adult, who does not want treatment for their addiction? What do you make of that policy? Because that is the debate that is happening in jurisdictions. So what do you make of the policy of putting someone in treatment who maybe doesn't want to go there and would have to do so involuntarily?
Well, at this point in time, the leader of the opposition isn't talking about policy. He has contemplated his own perspectives based on a very polarized and a lack of evidence-based view of what we know works in a continuum of care for those who are struggling with substance use.
If I may, though, this has come up in British Columbia. Even Eby, premier who's trying to get reelected, has talked about this policy, as have Alberta, as have others beyond Mr. Poilievre. So I'm just wondering if you as the minister can state the position as to what do you say to policies that say, I want to put someone in treatment against their will?
Well, what I'll say first and foremost is that healthcare is the purview of the provinces to address. It is their jurisdictional responsibility to outline the policies that they see fit. However, what I will say, what we've seen in British Columbia is the work of Dr. Vigo outlining very specifically that those who they contemplate as eligible for involuntary treatment are people with extreme complex needs that have been pervasive over time that require really a full range of supports from the healthcare system. So I would encourage British Columbia or any other jurisdiction to first and foremost, before they contemplate whether it is voluntary or involuntary, that they need the actual treatment services in place, which currently they don't have.
All right, thank you. And we'll go to Alessia from the Canadian Press.
Hi. Your department has said it's difficult to pin down how much of the federally funded safe supply of drugs is being diverted into the community, but is listening to stakeholders like the police. What were those stakeholders actually telling you about the diversion of safe supply?
So thank you for the question. When we talk about prescribed alternatives and diversion of prescription medicines, we're not talking about the same thing to begin with. Diversion is illegal. We have said that time and again. And when we talk about diversion being illegal, it is of any prescribed medication. That could be ADHD medication. That could be pain medication that someone has acquired post-op from a surgery in a hospital and goes home with. And diversion of any medication that is not for its dedicated use is illegal in this country. When it comes to the prescribed alternative treatment models that have been put in place, of which 4,500 Canadians are part of federally funded, federally supported programs for prescribed alternatives. We've put in very robust mitigation measures to ensure the safety and use of those treatment services. But again, health is the purview of provincial jurisdictions. We have worked with them very carefully on guidelines of how to administer and prescribe rapid access to addictions medicine. And it's up to the provinces to ensure that their physicians are well trained and well supported in providing supports for their patients and clients who are seeking help with addiction.
And I understand that you're not the public safety minister, but the ministers of Indigenous Services and Crown Indigenous Relations always speak about how there needs to be a whole of government approach to those issues. One of the biggest things that chiefs talk about is the lack of police in their communities to stop drugs from coming in. Do you see that as a problem, and are you working with public safety to get First Nations policing legislation off the ground to tackle issues like the drug crisis?
There is no question that when we look at the four key principles of how we're going to address this overdose crisis and the illegal toxic drug supply, that enforcement is a key piece of the puzzle. But we also know that the war on drugs failed. We also know that we cannot
But that's what community members want. If it's self-determined that they want police there to be, like, having checkpoints there, that's the self-determination of communities. I don't know if they would consider that the war on drugs there.
If you allow me to actually answer the question, what I was going to say is that an enforcement piece is an important piece of the puzzle, and we recognize that and have been working with our public safety counterparts to ensure that those discussions are ongoing to provide those supports, but they are only one piece of the puzzle in helping communities heal and push back against the overdose crisis.
All right, thank you. We're going to move over to the questions that we have on Zoom, starting with Mackenzie Gray from Global News. Mackenzie, if you can unmute.
Hi, Minister Sachs. I'd just like to go back to Stephanie's questions before. I didn't hear a clear answer, so I'd like to give you another opportunity in this. Does your government support provinces using involuntary treatment for folks who have drug addiction problems?
In terms of administering their health care, as we are always committed to do, but as I said previously, I haven't seen enough of a move of scaling to need of treatment by provincial and territorial jurisdictions to meet the moment. And before we talk about involuntary or voluntary treatment, I would like to see them utilize and access the robust $200 billion worth of healthcare agreements that have been signed across the country to dedicate resources to this. This is about political will in allocating the resources that they have to providing treatment access to those who need it in a way that is timely and accessible. And by accessible, I also mean low barrier access for those who need it most.
Minister Freeland got asked about this yesterday. I'd like to read back what she said to us when we spoke to her. And this is a quote: "We have to be sure people get treatment they need. And sometimes a person can be too sick to really recognize what treatment they need." Do you think that that is a situation across Canada where people could be too sick to understand that they need treatment?
I think that these are decisions that individuals make with their healthcare providers and with their families and loved ones in the care that is needed for them. And I think that's where we need to keep it focused from a human-centered lens, from a compassionate lens, and from a healthcare lens.
All right, thank you. We'll move on to Marina von Stackelberg from CBC.
Hi there, Minister Sachs. You talked about proposals opening for this program, and I'm curious as to when you expect money to actually flow to these communities.
The first round of proposals will close November 8th, and it is our anticipation for funds to flow as quickly as possible before the end of the year.
Before the end of the year. Okay, thank you. I just want to go back to the involuntary treatment question again, because I do think that it's important to get a clear answer from you. You know, the NDP and the Conservatives in BC are both proposing this. They say that this is part of a bigger treatment plan, but that it is something that they feel is necessary based on the crisis there. So do you, as the minister, support involuntary treatment?
As I said before, and I'll reiterate it again, before we contemplate voluntary or involuntary treatment, I would like to see provinces and territories ensuring that they actually have treatment access scale to need. They are not there yet. They have the resources and tools to do it. We are there to partner and collaborate with them to make sure that those systems are built out to meet the need and to meet the moment. And that is where my priority lies, is making sure that access to treatment is readily available in a timely manner, without wait times and without losing more lives.
Okay, thank you. Those were all the reporter questions that we had. If you have more time, I'm willing to open the floor again. But we could also, if you have to...
We have Yeah, we have a few more minutes if there are any more questions.
Perfect. I'll hand it back to you, Steph Taylor.
Thanks for sticking around. You talked about what you're hearing from stakeholders in terms of the harm reduction. You talked about drug testing. You talked about naloxone. Do you think Canada needs to expand its pharmaceutical alternative programs and/or expand the number of supervised drug consumption sites, which are other harm reduction tools? Do you think that the country needs to expand kind of those two latter ones?
So I am a firm believer that harm reduction is healthcare. Harm reduction does include safe consumption sites. It is concerning to me that this is becoming part of a polarized debate when we know that safe consumption sites just alone here have reversed 58,000 overdoses since 2016. We know the evidence shows that safe consumption sites work in community. They not only save lives, they are the access door for individuals who struggle with substance use to get primary health care, to begin to contemplate treatment and access to other tools and resources to get them to a better place in managing their addiction, but also being able to get into programs. When you close that door, we lose lives, we lose people, because the truth is that if we don't have a harm reduction piece to our strategy, then people will die alone. We know that these are the facts. And we also know that when they come to safe consumption sites, there's a reduce in criminality, there's reductions in individuals using elsewhere in unsafe environments. But again, this is about political will. We see other jurisdictions who ensure that safe consumption sites and prescribed alternative clinics are well-funded, well-resourced, and well-staffed, and work directly with community on engagement to ensure that there is a clear public safety lens on this, so that families in community feel comfortable and safe going about their day-to-day business, but also a public safety component for people who struggle with substance use. They also need to be safe. So from the federal government's perspective, we will continue to work with jurisdictions to provide best practices, best models, and best resources available from what we know from jurisdictions around the world where models have worked. And we encourage them, again, to use the resources that they've been provided, to find the political will, to not look away from people who are struggling and dying, to get them the health care that they need.
Are you suggesting that Canadians who take issue, whatever that issue may be, with, say, this supervised consumption site in their neighborhood, or the prescribing of pharmaceutical alternatives to those who are struggling with addiction, that if they're seeing issues stemming from those policies, they should take it up with their provinces and local jurisdictions versus the feds?
Again, we work collaboratively with every level of government to ensure that the health care services that are being delivered with a clear lens on both public health and public safety. But jurisdictions are responsible for the health services that they provide. We continue to provide guidelines and standards. We provide the regulatory structures for safe consumption sites that are adhered to by the operators. But yes, provinces have a key part to play in this, and we are here to work with them.
If I may, people that I speak to, and all of us do this, they see the crisis in our communities, and they want their governments, all three orders of government, to help people. And they also recognize that healthcare is delivered by healthcare providers. And so we need to utilize, as the minister said, all tools necessary to provide that care. That includes prevention, that includes harm reduction, that includes treatment. And any politician who's not a healthcare expert, by the way, tries to politicize any element of those approaches is really playing with people's lives. And we have to avoid that. We need to make sure that we're working together. This fund is an example of how we are going to be working with Indigenous communities and with municipalities in making sure that they have the necessary resources available to be able to provide those key services. This is about saving lives, period. And we need to use all approaches, all methods told by experts, because they are the one who knows best, to save lives.
Alessia, do you have another question?
I can pass my question on to staff or if anybody else online.
Okay, perfect. I might just go to Zoom. I'll just check with Marina. Marina from CDC, do you have any other questions? Your hand is still raised.
Oh, I love when I do that. Keep the hand up. Yeah, I just wanted to ask, especially about the stuff about vaping. There were health groups that came out last week, and Minister Sachs, they went pretty far, and they said that they think you should resign over a lack of movement on vaping. Just, I wanted to get your thoughts on their concerns and their call for you to resign.
So I do believe I'm going to be speaking to you a little bit later today about this, Marina, but if you'd like to talk about it now, what I will say is this. This government has made it very clear, and I have made it very clear in the many meetings that I have had with youth vaping advocates, including the ones who were on the podium last week. We've met with them multiple times over the course of my tenure and also my predecessor. And the discussions have been ongoing. I'm really solutions-oriented. I'm not really interested in political press release stunts. When folks who were up here last week on Friday knew perfectly well that they were meeting with me this week. So my approach to this has always been that we are looking at the health of Canadians first, particularly young people. I say that both as the minister and as a mother. But in a solutions-oriented approach, we also know that in jurisdictions like Quebec and in Australia, where they have pulled flavors from the shelves, there is an illicit market that has cropped up that young people continue to access. In Australia, with the prescriber model that they put in place, the illicit market is flourishing. So as we move forward in getting the regs right, I would encourage those who are very important advocates in this space to continue to collaborate with us so that we get a solutions-oriented approach rather than press conferences.
Follow up, Marina, and then we'll end it there.
I'm good. Thank you.
All right. Well, we'll end. That'll conclude our press conference. Thank you so much for your time this morning. Really appreciate you taking the time to take some additional questions.
Thank you.
Okay, so picture this. You've just had a new baby. Congrats, right? But the grandparents, they're getting that look in their eyes. You know, the one they want to be closer, but where would they even go? It's like a classic Canadian housing puzzle.
Yeah.
And it's something the Prime Minister's been tackling head on in some recent announcements. We've been going through his latest speech and the Q&A. And let me tell you, there's a lot to unpack.
It's interesting, though, because it's not just about, like, building a ton more massive condos. It's much more thought out than that. The Prime Minister keeps using the phrase multi-pronged approach.
Yeah, and another phrase that kept coming up was gentle density. So it's about creating more places for people to live, but doing it within the neighborhoods that already exist. Like, think basement suites, those little backyard cottages, maybe even a laneway house. But how's the average person supposed to make that happen right? Well, get this. New mortgage rules are coming out to make it easier.
And these aren't like the old school mortgage rules either. We're talking about refinancing your mortgage and getting a 30-year amortization for up to $2 million, specifically for building one of these secondary suites. That's a pretty big deal. For anyone who's not a mortgage expert, a 30-year amortization just means lower monthly payments. It makes it way more doable for people to afford these renovations. It's almost like he's saying, hey, if you want to be a part of the solution, here's some breathing room in your budget.
So instead of just depending on the big developers, he's giving everyday Canadians the power to maybe become landlords, even if it's just for their own family.
Exactly. It's a really interesting approach. Imagine having your parents close by in a cozy little backyard suite, or giving your adult kids a head start with a place of their own. It's all about making it possible for more Canadians to own a home and maybe even live with multiple generations under one roof.
Okay, but here's the thing. Even with more affordable housing options, you still need a decent income to afford any of it, right? And that's something the Prime Minister seems pretty concerned about too. He even wrote a whole book about it, Plutocrats, The Rise of the Global Super Elite and the Fall of Everyone Else. Kind of a mouthful, huh?
Yeah. It does make you wonder if that gap between the super rich and everyone else is just getting bigger and bigger. The Prime Minister definitely seems to think so. He's talking about how it's not just an economic issue either. It's social, it's political, it's about what it means to live in Canada.
It's about making sure everyone has a shot at a good life. So how is he planning to tackle this whole income inequality thing?
Well, one big piece of the puzzle is early learning and childcare. He actually used Ontario as an example. Apparently, childcare costs there are already down by something like 50%. Families are saving an average of like $8,000 per kid every year. And the goal is to cut those costs even further. They're aiming for a national $10 a day system.
Seriously. I mean, as someone who's seen those childcare bills firsthand, $10 a day would be life-changing. Forget a sigh of relief. That's like a full-on dance party for a lot of parents.
Totally. And it's not just about saving money either. It's about giving parents more choices. Affordable childcare would make it easier for parents, especially moms, to go back to work if they want to. It's about giving people more opportunities and flexibility.
And speaking of making things a little easier on the wallet, he also talked about that new dental care program. Sounds like a lot of people are already signing up for that. Something like 2 million Canadians and counting, I think he said.
Which makes sense, right? Dental care is so important, but it can get really expensive. This program is supposed to help with that so people don't have to choose between paying their bills and taking care of their teeth.
It's about having peace of mind, knowing you can get the care you need without going broke.
Exactly. And then there's the push for more green jobs.
Yeah.
But not just any green jobs. The Prime Minister was really clear about needing strong labor requirements.
So making sure these jobs actually pay a living wage with decent benefits, right?
Right.
Not just creating a whole new category of low-paying jobs in a brand new industry.
Exactly. It's about giving people a real path to the middle class, making sure that the switch to a greener economy actually helps everyone. So yeah, we've covered a lot of ground here, from building more homes to making those homes more affordable and dealing with this big issue of income inequality. But what about the economic engine that's going to make all of this happen? The Prime Minister had this really interesting meeting with a tech CEO that kind of gets at that.
So they were talking about critical minerals, those things that are like the basic building blocks for everything from electric car batteries to those fancy solar panels everyone wants these days.
Yeah, it's a pretty crucial point, actually, because as the whole world tries to switch over to this greener economy, the demand for critical minerals is going way up. And here's the thing, Canada's got a lot of them, just sitting there.
Okay, so we've got the good stuff. We're all set then, right?
Not quite. Here's the catch. China's kind of got a monopoly on the whole critical minerals thing right now. They control a huge part of the supply chain. And that's a big challenge for Canada and all of our allies.
So it's like a tug of war over these resources.
Kind of. There's this big push for everyone to diversify, basically, to find other places to get these critical minerals. So we're not all relying on China so much. The Prime Minister even mentioned something about targeted Chinese action, like they're trying to stop anyone else from competing with them. It's a messy situation with some pretty big potential consequences.
Speaking of messy situations, what about those basement suites and backyard cottages we were talking about before? It's great if you can afford to build one, but what about people who can't even afford to buy a place in the first place?
That's the million-dollar question, isn't it? Will any of this actually help younger generations get into the housing market, or are they just going to get priced out even more as prices keep going up? The Prime Minister seems to think that building more homes will eventually make prices go down, but it's something we'll have to wait and see about.
But couldn't all this gentle density cause some other problems? What if every other house on your street suddenly had a basement suite or a laneway house? Wouldn't that totally change the feel of the neighborhood?
That's an interesting thought. Is there such a thing as too much housing? It's not an easy question to answer, and it's something that communities are going to have to figure out as these policies start to have an effect. But on a more serious note, we can't finish this deep dive without talking about another really important issue facing Canada, the opioid crisis.
You're right. The Prime Minister didn't shy away from it at all. And he talked about it in a really compassionate way. You could tell that he understands how much this is hurting people, individuals, families, entire communities right across the country.
He really emphasized the need to find a balance between keeping the public safe and getting people the treatment they need. He kept saying that addiction is a health problem, not just a criminal justice problem. It's about giving people support and resources, not just locking them up.
And finally, let's talk about something that affects a lot of Canadians directly, pharmacare. The legislation passed. So when can we expect to see those benefits that were promised, like free contraception and medication for diabetes?
The Prime Minister seems really gung-ho to get these programs up and running, but he did admit that there are still some roadblocks, especially when it comes to working with the provinces and territories. There's a lot of talk about everyone working together and finding common ground. We'll just have to see how smooth the whole process actually is. So there you have it. We've covered a ton of ground today, everything from basement suites and mortgage renewals to critical minerals and the opioid crisis. It's pretty clear that there are both big opportunities and big challenges ahead on the road to a more affordable and equitable Canada.
And you know what? I don't know about you, but I feel like I've got even more questions now than I did before. Will any of this actually make a real difference? Can we figure out how to navigate this whole global resources situation and make sure Canada has a good spot in the world? And maybe most importantly, what are we all going to do to help shape the future of our own communities? These are questions we all need to think about as we move forward.
For sure.
If this deep dive got you thinking or even just inspired you to get a little more involved, then we've done our job. Until next time, keep asking those tough questions and searching for those insightful answers. This is The Deep Dive signing off.